Let's bring in our next guest, Gail Mallard-Warren. Hello, doctor. How are you doing?
Nice to see you.
Doctor is a OBGYN. I don't talk to many of you.
No, you shouldn't either.
but last time I talked to you, we sure had a lot of fun talking about what you do. Yeah. Tell the people what it is that you do.
Okay, I have a med spa called BodiLogik, and we have the Mona Lisa touch there, which is a CO2 laser for treating some of the issues that come after menopause.
A CO2 laser?
Yes.
That's different than a regular laser.
No, laser is by the energy, so this one uses CO2 to deliver the energy.
And what tell them what you're doing, because I certainly don't want to say it.
Okay, well what we do is it treats the vaginal changes that occur in menopause. When the estrogen levels go down, we get vaginal dryness, thinning, burning, and pain with intercourse. So a lot of women don't speak about it. They don't know who to tell.
Who would?
Well, they can talk to the gynecologist, but all we've ever had were pills and creams, and they don't work as well. But the
what would the pills and creams, estrogen creams or something?
Replace the estrogen.
And it would and that would give it back feeling?
It's not so much just
take away the dryness?
The dryness and increased lubrication, but nothing works as well as the CO2 laser.
What's the problem with the dryness? Is it walking around? Is it sitting?
Oh yeah, it's everything. When it's there, it's just uncomfortable. There's not a lot of lubrication, and it's burning and itching, more prone to vaginal infections, more prone to urinary tract infections. And the main thing is intercourse is painful, and because of that, most women think there's something wrong with their libido, but what it is, it's uncomfortable and painful, and most people do try to avoid things that hurt.
So they're turning it off up here because it doesn't feel good down there.
That's the best way I've ever heard it put.
Really?
Yes.
Now, have you gone through this yourself?
Oh yes.
Oh, okay.
Oh yeah. Right. So I went to a conference when I first heard about this technology, and I knew I needed to bring it to Fresno because I needed it myself. So I brought it here. So and I positioned the Mona Lisa touch in the BodiLogik Med Spa.
You brought Isabel with you today. Hello, Isabel.
Hello.
How are you doing?
I'm very happy.
You are a patient?
Yes.
Is that what we call them?
Or a client.
A client.
BodiLogik,
okay,
yes.
A client. And you've had the technique done?
Yes, I have.
Okay, we're going to need you probably to speak up a little bit more, Isabel.
Yes, I have.
You have, and were you suffering from the things that Gail's talking about?
For 10 years.
Wow.
Secretly, not telling anybody.
And so you're suffering with it for 10 years. How did you hear about it?
I heard about it from a friend that went.
Okay. And your friend said, oh my gosh, it changed my life?
Exactly.
Does it really?
It sure does.
Yeah?
With the first treatment, we started going to the coast. With the second treatment, it was even more frequently. With the last treatment, I got a new car. And I'm going on vacation at the end of this month. And I'm very satisfied.
Well, wait, time out. Are you giving me an analogy, kind of?
I'm giving you a true story.
That because of the Mona Lisa touch, your sex life at home has gotten better?
By far.
And it's gotten so good that you have a new car?
Yes.
All right. Yay, good for you, and good for you, doctor. Is this the kind of stuff you hear all the time?
I'm hearing more and more of it because the word is gradually getting out that the technology is here.
What are ladies saying to you when they come to you?
Well, they've suffered in silence.
Distraught?
No.
It doesn't tell me how they feel. I don't want to guess.
Well, they come anticipating some relief. It's been going on for so long. They've tried the creams, they've tried the gels, they've tried everything, and nothing has worked satisfactorily. So they're excited that this might work. And when it does, they're doubly excited because it does. It is a life changer.
Wow. Now, let's go back, because you said that this is something that ladies don't talk about.
Right.
And they only talk about this with their doctor.
Right.
So when they come to you and they start telling you this, you know exactly what to do immediately.
Well, they already know because they've heard that this is what this treatment is for. So they're coming knowing they already have this, knowing they've tried other things that haven't worked, and knowing they want to give this a try.
How long does the procedure take?
It's a series of 3 treatments at 6-week intervals, and each treatment takes about 5 minutes.
That's it?
That's it. No pain,
so
no
you're
anesthesia.
just going in there and
no
shooting it a little bit, and then...
Well, the Mona Lisa Touch, we use a probe, which is about the length of a normal vagina, and it's
length or depth? Length.
Depth, length.
Top to bottom.
Sure, yeah.
Okay.
It's about this
You're
long.
the doctor.
Trying to get the right words. It's about this long. Okay. And it's calibrated at centimeter increments.
Okay.
And we put the probe in as far as they can tolerate, and then we back it out at increments, treating the full circumference of the vagina all the way out.
So you're working on the inside?
Yes.
Okay. And it's in, and it's working. It's shooting the laser around in there?
We rotate all the way around.
It's rotating around
right.
like that. And you're going from all the way in to all the way to the outside.
Yes.
How does it feel?
It's not painful at all.
It's not painful? It's not discomfort?
No, not
it's
at
not
all.
uncomfortable?
Not at all.
How did it feel afterwards?
Well, we had to abstain sex for 3 days. But then after that...
It was on?
Like a firecracker.
It was... Okay, so it's 3 different sessions, and then you're done?
Yes, done. They're recommending a touch-up every year, once a year, about 12 months.
And not a 3-week?
No,
just
it's just one time.
No kidding.
That's it.
This is kind of fascinating.
It is.
This is the way that medicine's going, isn't it?
Yeah. The way the laser work is it stimulates collagen production. So they're finding that the stimulation of new collagen is affecting like all areas of medicine. Dentists are using it to regenerate gum and bone. It's what happens when you can regenerate collagen, and that's what the Mona Lisa Touch does.
Does this just happen to women that are going through menopause, or can it happen to women before that?
It has to do with estrogen. So whatever causes the estrogen levels to fall will lead to this change in the vaginal tissues.
The men and women of Fresno are so glad you're here, Doctor. Look at the smile Isabel's got going on. You're smiling here. The studio audience is smiling, and you got a new car. All right, Doctor, if they want to get a hold of you, how do they do it?
Okay, they can reach us at BodiLogik Med Spa. We'll call ourselves the Regenesis Med Spa because we're regenerating things.
Awesome.
And the phone number there is 435-6445.
Nice. Is there a website that they could go on and kind of check things out?
Yes, the website is by its name, MonaLisaTouchFresno.com.
Very cool. Now, does insurance take care of any of this?
No, because it doesn't have a billing code, and right now, that's why it's positioned at the med spa and not in my office, because it's not a billable medical service.
Okay. All right. Can people just come by maybe?
Anytime. They can come by. Consultations are free. They can just drop in or make an appointment at the BodiLogik.
Where are you located?
We're on the 1st and Bullard at 6103 North 1st Street.
Awesome. Doctor, it's always so good to see you.
Well, thank you
for
so
coming
much.
by. Isabel, thanks for sharing your story. I think you're pretty awesome, too. Hey, we're going to take a quick commercial break. We'll be right back on The Buzz. Stick around.